It's the dawn of a new decade. You can be you again with mini dental implants. Do you suffer with loose dentures? Are you embarrassed to smile because you're missing teeth? Mini dental implants will change your life.
I've had problems with my teeth.
I had this big hole in my mouth.
I knew it was time to do something permanent.
It's just unbelievable what it's done to my life.
I feel like me again.
It'll be the best, smartest move you ever made.
Kind of gave me my life back.
Mini implants are the only way to go.
Just real happy I did it.
I would recommend it to anyone.
Do it over in a heartbeat.
It's been great.
It's incredible. It is. It's absolutely incredible.
Hello everybody, I'm John DeSciullo and welcome to Innovations in Health. We are talking about the mini dental implant procedure. It will change your life. You can be you again. And I'm welcoming to the show Dr. Matthew McRae from McRae Family Dental, with locations in Athens, Georgia, in Baxter Street, Trail Creek, and Epps Bridge. You can be you again with the mini dental implant procedure. Ladies and gentlemen, it's 5 times less invasive, less pain and discomfort, less healing time, less visits to the dentist, less expensive. You can have your life back with your family, friends, enjoy the food that we love here in Georgia. It's like biting into an apple, an ear of corn, and of course, everything we love in the great state like pecans and peanuts and peaches. Ladies and gentlemen, this is without fear of your dentures falling out, and it's just amazing. We're going to get to know Dr. McRae in just a little bit, but welcome to the show.
Thank you.
Let's start with the models that we have in front of us. If you have a lower denture, odds are it's swimming around in the bottom of your gums, and it's inconsistent, it may fall out. The mini dental implant procedure stabilizes the lower denture. Show us how.
The number one reason that we have a lot of our patients comes in because they're tired of their lower denture moving about when they try to eat. They're tired of putting in the different adhesive and things that get in the way, interfere with the taste of the food. So we're able to put in 4 of these mini implants. They look like a ball on a trailer hitch. So we put that in the bottom, and inside the denture, we're able to put in metal housing with O-rings in them that snaps over, and it holds everything into place to keep it stable. You're able to eat your food and enjoy your food without the denture moving about on you.
And without all that glue and goop.
Yes.
You know, that people swallow that, it must taste terrible. It just, I can't imagine. But yet some people just sort of accept that as a way of life. They don't need to do that anymore with the mini dental implant procedure.
Exactly. You can get them stabilized without having to put any type of adhesive in them to hold them in place, because they snapped in place by the O-rings, and the mini implant stabilizes everything.
So Doc, if you have a lower denture, odds are you probably have an upper denture. And one of the things we talked about the great food that we love here in Georgia, you want to be able to taste that food, and the mini dental implant for the upper denture affords the opportunity for the patient to get the sweet, get the sour, get the hot, get the cold, because their palate is exposed in addition to the stabilization. Show us how that works.
On the upper, and you can see from this that there's a horseshoe shape appliance that allows the taste of the food to go into the palate. Temperature sensitivity, you can taste that as well as the denture doesn't have to go as far back into the mouth and interfere with the gag reflex.
So that area that you just showed us with your finger is where plastic is now currently in place.
Right.
And even your speech could be impacted by that too. So that's removed, and then these rings, as you call them, the trailer hitches, work with the titanium posts to keep it in place.
Exactly. We have, on the top here, we have 6 implants, 2 in the front and 2 on each side. Inside this denture as well, you have the metal housings, and with the O-rings that snaps and holds everything into place.
There it is. And you know, so many people have the fear that their teeth are going to fall out, the dentures, when they're with their family at a function. And that is minimized, if not gone completely, with the stabilization that these mini dental implants offer with the dentures.
Exactly. It holds everything into place. You don't have to worry about your dentures jumping out and embarrass you in public.
So if you are watching anywhere in Athens, Atlanta, Conyers, Lawrenceville, Augusta, and anywhere in between, Dr. Matthew McRae at McRae Family Dental will help you. Now, the mini dental implant we just saw with the denture is one thing, but there's another level, and this is called the fixed on 6. Take a look at this.
Okay. This is a step up here. The same thing, we have 2 implants in the front, 2 on each side. But on this particular prosthesis, you don't have any of the pink gum or plastic. This prosthesis goes in, snaps into place, and it has a more natural appearance. You have no acrylic at all in here, no outside.
And it's no plastic because there's not a denture.
Exactly.
And this can be an upper or a lower or both.
Yes.
It's bad going through life having to cover your face because you're embarrassed of your teeth. It wasn't comfortable at all. I didn't want dentures. I had the fixed on 6 done. It was easy. It literally changed my life. I can eat anything now. I can smile, I laugh. I don't have to cover my face anymore. It was awesome.
So if God gave us our baby teeth and adult teeth, Dr. McRae is going to give us the 3rd set of teeth with what we would define maybe as the Rolls Royce of the mini dental implant. It's called the roundhouse.
Okay, on this one you can see that there's mini implants all the way around, or roundhouse as it was stated. And what happened here is that you have a prosthesis that's fabricated to look and feel like your natural teeth, and it goes in, and it's actually cemented into place, and it brings you back to an ideal situation. You can look, chew your food, and look great at all times.
And this is a solution that's permanent. And with the other fixed on 6, you want to go in and see you every 6 months or so to get a checkup and see how it's doing.
Exactly. The worst thing could happen is that you get this done and never go back.
Yeah.
And we want to make sure that we're seeing you 6 months, or even sometimes some patients we have them come back every 4 months to make sure that everything is stabilized, no irritation or any infection, anything like that is happening.
So imagine, Doc, people must be coming in saying, I want to bite into that fried chicken. I want to bite into that ear of corn. You said that's something that people really get excited about doing, and they can do that with the mini dental implants.
Exactly. Food is very expensive, whether you're buying it or going out to a restaurant, and you want to be able to sit down, taste your food, enjoy your food, and just enjoy the conversation as well.
Yeah. Now, speaking of food, the teeth that are in the back of your mouth, that sometimes you may neglect. You figure it's out of sight, out of mind. But those back teeth, they're the teeth that chew the food. So the mini dental implant, and Doc McRae is going to show us this is like a bridge. This is something where your mouth will get full again by getting this procedure.
Exactly. On this side, you can see that a couple teeth are missing. And rather than leave them out and the other teeth start drifting and shifting, creating malocclusion that might lead to TMJ and other problems, mini implants are placed, a bridge is fabricated, and it cements in, and then one side looks like the other side. Absolutely gorgeous.
And those front teeth bite into the food, but those back teeth chew the food. You get all the nutrients out of it.
Yeah, that's where the grinding takes place in the back.
And that titanium post, everybody, is what the tooth and the denture adheres to, and the bone actually grows around it in the gum called osseointegration, so that it actually gets stronger over time.
Yes, it's almost like putting in a fence post and then putting concrete around it, and it won't move.
So if you knock a front tooth out, the mini dental implant will fix this issue specific to your custom mouth.
Okay, we have an example here of a tooth that's been knocked out or missing or extracted. And in order to replace it, a mini implant is placed into this particular site, and a custom crown is fabricated to look the same color, same shape and form. It cements in, you're back to normal.
And this is something that could happen to anybody of any age, whether it's a younger person or an adult that's had an issue. And we should mention, Dr. McRae, these are made in America products, FDA approved, custom made for your patient that comes to see you at your practice.
Exactly. They're not sent overseas or anything. They're here in the United States with great quality control to make sure that the product we get is of the highest standard. And
it happens in your office at one of your 3 locations.
Exactly.
The Baxter Street location, 2 blocks from the University of Georgia, near the Atlanta Highway at 995 Baxter Street in Athens. Trail Creek location is past Athens Tech in the Kroger Shopping Center, 680 US Highway 29 North, number 240 in Athens. And the Epps Bridge location near the Home Depot in the Kroger Shopping Center at 1720 Epps Bridge Parkway, number 110 in Athens, Georgia. We love Athens, Georgia. So Doc, let's talk about you. You are a man of Georgia. Where did you grow up?
I grew up in south central Georgia in a town called McRae, Georgia. Twin City, McRae, Helena is halfway between Waycross and Macon.
Family connection to the McRae?
No, it's 5 sets of McRaes in McRae when I grew up, and none of them claim each other.
Where did you go to school? How did you get into dental?
At dental school, after finishing high school, I ended up at Fort Valley State. I did 4 years there, and during my junior year, they was just starting the new dental school in Augusta at the Medical College of Georgia. I applied there. After the deans came down for recruitment, I got into that class. It was a class of 37. And we started out on a 4-year curriculum, converted over to a 3, and I finished dental school September 22nd, 1973.
1973, so you've been practicing well over 50 years.
Well, it's coming up on, this is the 50th year.
Yeah, that's terrific. Congratulations. And we should mention, folks, that Dr. McRae is a lifelong learner because the technology has changed so much in the 50 years, and we'll talk about that in a little bit. But we also should mention you were honored by Augusta University with a portrait. I know 11 Alive covered it. You were the first African-American to graduate from dental college. Congratulations on that honor.
Thank you, thank you. That happened back in April this past year. They did a wonderful portrait. They had a nice ceremony. We was fortunate to have close to 75 of my close family members. And the young lady did a beautiful job on the portrait, and we are honored to be the first graduate there.
Well, and you were inspiring others, I'm sure. The background on Dr. McRae is on the website, drmcrae, drmcrae.com. But we should note that your professional organizational memberships include the Academy of General Dentistry, Georgia Dental Society, Clark County Dental Society, National Dental Association, Implantology Dental Society, and the Christian Dental Society. And I know, Doc, you're a man of great faith, aren't you?
Yes, yes. I was inspired by one of my mentors when I was in dental school. It was Daddy Carter. He had practiced for 50 years. At that particular time, I said, wow, wait, 50 years, that's a long, long time. But when I moved to Athens, my church started doing mission trip in Nicaragua. So that was in '96, right after the war they had down there. So for about 12 years, I would go there and we would do mission trips. We actually started a school there in Los Marianas. And from there, recently we've been doing a free day of dental service on MLK Day. And we try to give back on that day over $100,000 in goods and service, whether it's in bloodmobile, different types of screening, chiropractic, food bank, and we do free cleanings, free extractions, and free fillings on that particular day.
Tell us about your family.
Yes, my family. While I was in dental school, I didn't only get a dental education, I got a wife as well. We ended up, I had a way of releasing stress. Each day I would finish, I would go across the street to Payne College and I would jog for 2 miles. And I met my wife one day. She was over there with another young lady. She was on a break. She actually went to Benedict College. So I called her about 2 days later and told her that we started talking. And I was in March and I said, I'm gonna marry you before the end of the year. She said, you're crazy. And lo and behold, it actually happened. And I told her she can't leave me because I needed $25 to get a marriage certificate and everything. So I went to the hospital and I sold my blood for $25. So I bought her with blood money so she can't leave me.
That's it. You're in. And how many children do you have? And you have grandchildren too.
Yes, we have 12 grandchildren. We actually have 4 children. When we married, the first 6 years we had no kids. The next 5 years we had 4 kids. So they all boom, boom, boom right behind each other. I didn't think about all these kids going to be in college one year.
And now some of them are working with you in the practice, including your wife.
Exactly. My oldest son, he actually runs the 3 practices. My wife works as well.
It is family dental.
It's family, and I get a chance to do the fun stuff. And they take care of all the administration part of it.
Right, and you get to work with your hands and work with your patients. And you're a lifelong learner, and your son pointed that out in a video that's on the website. And part of that journey in looking at all the technology that's changed in the 50 years that you've been practicing dentistry, is the mini dental implant. And I know you head on up to Buffalo, New York, and work with Dr. Todd Shatkin and learn the latest in techniques. How did you connect with Dr. Shatkin and learn about the mini dental implant procedure?
Okay, we had family reunion this past year in New Orleans, and I woke up around 3 or 4 o'clock in the morning, and flipping through the channels, and it was a young lady that came on from Covington, Louisiana, and it caught my attention. She was talking about the good things that she'd done and about this place, and I could see it in the background, checking. So I made sure I memorized that number, and I listened to the whole information there that she had, and I immediately called to see when the next course was being given, and we ended up signing up for the course. We came up, and it has been nonstop. I actually went through all of his Monday morning minutes before I took the first course.
So you're learning, you've gone up to Buffalo, you bring all of that technology right back here to Georgia and offering everybody the most advanced opportunity to look their best. When you go into the practice and we visit you or one of the dentists, it's a free consultation. What do you do when you talk to the patient? And you can look right into that camera and tell them what they can experience when they come to see you.
When you come, first of all, when you come in, we want to learn something about you. You know, how did you get where you are, and what are your goals, what you want to accomplish. And we do a thorough exam on you. We will go ahead and do a 3D x-ray to see how much bone support you have left. We go ahead and see if you want to continue for us to design your case. We give you a breakdown on the different things that you could do. You can start out maybe with just 2 to 4 implants and eventually end up with 12 or so. So it's a situation where you start out is not necessarily where you might end up. This system is designed to grow as you want it to grow. To eventually, if you want to end up with a roundhouse that's cemented in, we can end up there. If you want to stay with this denture stabilization, we can do that as well.
In addition to the free consultation, I know sometimes people need second opinions, and you help them with that.
Sure, we're glad to give second opinion all the time.
All very important. And I know you work with the patient. You know, we all are used to paying for a car monthly with a car payment or pay for a mortgage, and not that it's that expensive, but the concept of paying down for something is not a new idea, and you work with the patient to make this an affordable option.
Exactly. We have different payment options that we have available for you. We work with you in any way possible. You know, we can have the finances. You can go to your bank. We break it down like how do you eat an elephant, a small bite at a time. So the same concept, you can pay for this over a period of several years if necessary to get your mouth where it needs to be.
And people should make that investment in themselves, no matter what their age. You know, we've talked with a lot of different patients, and they say, boy, I can now eat all the food I want to eat again. I can enjoy life again. I don't have that fear of the denture falling out. So it's an investment in yourself, no matter what your age, to live your best life.
Yes. Well, I look at it as you mentioned about a car, but a car immediately starts depreciating on you.
That's a good concept. This is not the case. It gets better.
If you get your teeth restored, it's going to help you all the way around. You're going to chew better. You're going to feel better. You're going to look better. And we notice with a lot of our patients, once they get the mouth fixed, the next thing they want to do, they start doing eyelashes, they change their hair, they even get an upgrade on the spouse, not the spouse, but the mate or whoever.
So the mini dental implant can lead to a lot of life changes.
Exactly.
Yeah. Let's talk about your patients. When they come to you and they get the mini dental implant procedure or any one of the opportunities that you have for dental work, what do they say to you? What's their reaction?
Well, it's a change in their life. It's a change in the way they perceive themselves. Their confidence level goes up. They're chewing, they're tasting their food. Some of my patients, they have not enjoyed their food in years, but all of a sudden they can enjoy their food now. They can go out, they can speak to people and don't worry about putting a hand over the mouth. or things like that, they don't feel embarrassed any longer. You know, they feel more vibrant, alive, and it's just the confidence they feel.
It is important. I've had some dental work done, and it does make you feel so much better. And it's not just mini dental implants, it's other procedures that you may have. So if you're watching our program and you're thinking you want to connect with Dr. McRae, the website is drmcrae, drmcrae.com. And I know you work with a lot of veterans too.
Exactly. Yeah, we have, believe it or not, veterans. Like I was saying before I came up here, there was a guy who drove 4 hours from Savannah.
That's amazing. And he came just to see you to work with your practice.
Exactly.
Yeah. What did you do?
Well, on this particular gentleman, we ended up doing, I think we did about 6 crowns, we did implants, we did some extractions, and the advantage is that a lot of these procedures, rather than doing a little bit at a time, we are equipped to do a multiple task in one day. What takes a lot of dentists maybe 3 to 4 or 5 appointments to do, most time we're able to do them is 2 or 3 because we are one shot stop. You know, we can do implants, we can do surgery, we could do crown and bridge, we can do root canals, all in the same visit.
All in the office. And we're going to give you the locations of where McRae Family Dental is. But before we do that, let's listen to some of the patients and hear from them about what the mini dental implant procedure was like.
Getting the mini dental implants was a life changer for me.
If you're concerned about your looks, then obviously this is the way to go.
Not a second thought about it. I would do it again.
How could you go wrong?
I just can't say enough about how I feel.
Everybody's in the office has made me feel like a person, not just a patient.
It's one of the best things I've ever done in my lifetime. I mean it sincerely.
This is something that is so incredible.
I feel a lot more confident. My smile feels better.
And it brought a lot of confidence back to me.
It's just amazing what it does for your self-confidence and how you feel about yourself.
After the procedure, wow, yeah, you smile.
But now I smile all the time.
I am very happy I had the procedure done. I feel as though I have my smile back.
It's just unbelievable what it's done to my life.
It kind of gave me my life back.
I feel like I do have more confidence than I did before.
It's going to sound corny, but I mean, it is a life-changing event.
It literally changed my life.
Great to hear from those patients and everything that they've experienced, all the positives of the mini dental implant from McRae Family Dental. Here are the locations. Baxter Street, 2 blocks from the University of Georgia and near the Atlanta Highway at 995 Baxter Street in Athens. The Trail Creek location, past Athens Tech in the Kroger Shopping Center, 680 US Highway 29 North, number 240 in Athens. And the Epsbridge location near Home Depot in the Kroger Shopping Center, 1720 Epsbridge Parkway, number 110 in Athens. 3 locations. Doc, you have a lot of treatment rooms, don't you? So for people that are coming in from anywhere, you can take care of them.
Exactly. We have 21 operatories between the 3 locations. And the office hours, we have from 7 in the morning to 7 at night, and we do have Saturday appointments available as well.
That's great. You make it convenient for the patient.
We try to exceed our patient expectation. If you over-deliver, and that's what we try to do, over-deliver to our patient, exceed the expectation, they will come back. Not only will they come back, they will refer others to you as well.
Yeah, very important, that customer connection. And the care that you have for your patients is very evident. We talked about the fact that it's less pain and discomfort, very little, if any. What do you prescribe? I hear it's like an ibuprofen, something over the counter.
Yeah, I use ibuprofen, we use Aleve, Tylenol, or something like that as well.
Yeah, and I know that caring for the mini dental implant and dental care overall is very important. And flossing, we always hear about brushing and flossing, but the water flosser is very important, isn't it?
Exactly. It's pretty much mandatory. We actually have all our patients to use the water flosser or the water pick, and the other things that we're adding to all of my implant patients as well is that we give them a night guard to sleep in to make sure they don't overstress the implants or the other teeth.
We should mention too that you offer sedation dentistry, so if somebody has a little fear of going to the dentist, you'll work with them with that, won't you?
Exactly. We can give you some pills to take and You won't even remember the procedure.
Now, if you've been watching us for the whole half hour, you got a chance to see what we call the models earlier in the presentation. If you joined us halfway through and you're listening to this and you're saying, well, what is the mini dental implant? Now we're really going to show you, and this is going to hammer it home. So imagine, folks, if you have a denture, and I know some of you out there are watching who have dentures, and that bottom denture, that lower, is swimming around on the bottom of your gum, and you're exasperated, you don't know what to do, the lower can be stabilized with this procedure. Dr. McRae, show us.
Yes, we have, on this particular instance here, we have 4 mini implants that are placed in. You have the houses in the top, it snaps in. This way you're able to keep the teeth in your mouth, not in your pocket.
And if you have a lower denture, odds are you probably have an upper denture. And as we talked about, the great foods that we love in the great state of Georgia, you can now taste all over again because the palate is exposed.
Exactly on what we have here, this is an upper denture that's been made in the form of a horseshoe with the housings in the top. And what happened with this being cut out, you could taste your food and it's not going as far back and you're not having a gag reflex with it.
Dentures are one thing, but there's another level to the mini dental implant. This is called the fixed on 6.
There again, we have 2 implants on each side, 2 in the front. And we have a bridge, a round bridge here that goes, snaps.
And there it is, and it's a porcelain product. This is, made to take a licking and keep on ticking. These are just as good as your real teeth. As we mentioned earlier, if God gave us our baby teeth and our adult teeth, Dr. McRae is going to give us our 3rd set of teeth with this permanent fixed solution called the roundhouse.
If you look here, you can see from you start at one side, you go all the way around, you see the mini implants that's been placed in. Then you have this prosthesis, which is a roundhouse that totally restores the whole upper arch. It goes, it cements in, and as you can see, everything has been totally restored, and you're back to new again.
And we talked about the great foods here in Georgia. Now that back teeth, those very important teeth that chew all this great food, they need to be worked on, and how the mini dental implant can change it is what we're going to see next.
Now this is an area where 2 teeth are missing, and in the past you would have to reduce the tooth behind it, reduce the tooth in front of it, and create a bridge that goes in. But a better way is to put in these mini implants, not touching these other teeth, and then just cement the bridge over the mini implant.
Now if a tooth falls out, the mini dental implant can change your life.
This is a tooth that's been extracted, knocked out, and you can see the mini implant here in place, and then a custom crown is fabricated to duplicate what the tooth on either side of it looks like, and you can place it back in, totally restored.
Custom fit, made in America product, and made to look just like your other teeth. Dr. Matthew McRae from McRae Family Dental. Again, here are the locations on Baxter Street, 2 blocks from the University of Georgia near the Atlanta Highway, 995 Baxter Street in Athens. The Trail Creek location, 680 US Highway 29 North, number 240 in Athens. And the Epsbridge location, 1720 Epsbridge Parkway, number 110, Athens, Georgia. 3 great locations from anywhere you want to come from. You're coming in from Atlanta, you can do that. Lawrenceville, Conyers, Augusta, wherever you're coming in from, Dr. McRae is going to help. Well, you are an innovator in health, and I appreciate you being on Innovations in Health.
Thank you.